Acupuncture is one of the most typical and widely applied practices of traditional Chinese medicine. As of 2006, China Association of Acupuncture Moxibustion began to organize experts to institute state standard for acupuncture moxibustion manipulation techniques. The project was approved by Standardization Administration Committee and undertaken by State Administration of Traditional Chinese Medicine. In April 2008, General Administration of Quality Supervision, Inspection and Quarantine, and Standardization Administration Committee approved that National Acupuncture Operation Standard for moxibustion, cupping, three-edged needle, scalp acupuncture, auricular needling, subcutaneous acupuncture, intradermal needling, acupoint injection, acupoint patch therapy, and acupoint catgut and bedding therapy shall come into effect as of July 1, 2008. To promote the study and implementation of these standards, China Association of Acupuncture Moxibustion produced the practical guiding discs for the national standard, Regulations for Acupuncture Operation, in cooperation with PLA Health Audio and Video Publishing House, in an attempt to promote the development of acupuncture teaching, clinic application, scientific research, and international exchange in an orderly, standardized, and correct way. Ensure the safety of acupuncture operation, improve the efficacy of disease prevention and acupuncture therapy, and strengthen the standardization, moderation, and internationalization of acupuncture medicine. Skin needle therapy is a method that applies skin needle tapping channels, acupoints, or certain skin area to cure diseases, which is the development of ancient therapy of Maozi, Yangzi, and Banzi. It can be used widely both in clinic and family health care, because it is operated easily and it has good effects without side effects. It is effective to more than 180 kinds of diseases according to related clinical research and observation, which covers internal, external, gynecological, and orthopedic diseases, and so on. This video is taken on the basis of the National Standard on Manipulations and Technique of Acupuncture. It will introduce in detail the practical steps and general methods of manipulation, and give a brief introduction of clinical application in several common diseases. Mechanism. The 12 skin areas are the zongzis, which are the distribution of the 12 meridians on the skin connected with the organ inside. The skin needle therapy is a method that uses special needles to prick the skin superficially by tapping skin areas of channels or acupoints to promote the smooth flow of qi and regulate the functions of the zangfu organs, so it can keep the balance of yin and yang of the body to cure diseases. Needles. The skin needle is made of many short stainless steel needles, which are bound together or affixed to one end of the handle in the shape of a lotus seed pod. The skin needle has different types, such as the palm blossom needle made by 5 short needles, 7-star needle made by 7 short needles, and Arhat needle, 18 needles. Preparation before manipulation. 1. Needle selection. Skin needles are selected according to the patient's condition and manipulation location. The needle should be restless with smooth body, sharp tip, and fixed handle. 2. Manipulation location selection. Proper locations should be selected according to the diseases. 3. Patient's position selection. Position should be selected to make patient comfortable and doctor's manipulation convenient. 4. Environment requirement. Environment should be clean and not polluted. 5. Sterilization. Needle sterilization. Vapor sterilization of high pressure should be selected. Location sterilization. Cotton balls with 75% alcohol or 0.5% idle force should be selected. Operator sterilization. Doctor's hands should be washed with soap suds and cleaned with 75% alcohol cotton ball. Manipulation methods. 1. Posture of holding needle. Skin needle with soft handle. Put the end of the needle handle in the center of the palm with the thumb upper and index finger inferior. Other fingers hold the handle with clenching. Skin needle with hard handle. Hold the needle with the thumb and the middle finger and place the index finger on the middle part of the needle handle. The ring finger and little finger fix the end of the needle handle in the thenar and hypothenar eminence. 2. Tapping methods. Prick the selected points or area vertically by tapping the skin with the tip of the needle swiftly using wrist action. 3. Stimulation intensity. Mild stimulation. Tap the skin gently with the needle until the skin becomes red and slightly congestive. Moderate stimulation. Tap the skin with a moderate force until the skin is congestive but not bleeding. Strong stimulation. Tap the skin heavily with the needle until the skin bleeds slightly. 4. Tapping location. Tapping at points. This method is used to tap points according to the condition to be treated. The commonly selected points in the clinic are backshoe points, 夹击 points, specific points, and 阿氏 points. Local tapping. This method is used to tap the locally affected area. Tapping along the meridians. This method is used along meridians related to the diseases. The most commonly selected meridians are the governor vessel and the blood meridian on the back along the spine. Meridians below the elbows and the knees are also selected. After tapping, the area should be strictly cleaned and sterilized to prevent infection, especially if bleeding occurs. Precautions. 1. When tapping, the action should be even and the needle's tip should be vertical to the skin surface and free from hooking in order to reduce pain. 2. Cupping therapy can be used after with the treatment of skin needle. The manipulation of cupping should correspond with the state standard of China, GBT 21709.5 to 2008. 3. The treatment interval should be according to the patient's condition. When tapping with mild or moderate stimulation, once a day or twice a day. When tapping with strong stimulation, once a day or every other day. 4. Pay attention to the prevention and treatment of acupuncture syncope. If acupuncture syncope occurs, stop tapping immediately. Let the patient lie on the bed with head lower and foot higher. And drink warm boiled water or sugar water. Pinch the acupoints 率骨 Governor Vessel 26, 内关 Pericardium 6 to promote recovery. 5. The therapy is not advisable for patients with mental strain, perspiration, fatigue, or hunger. 6. The therapy is not advisable for patients with local infection, ulcer, trauma, or sick trichol. 7. Doctors should not touch the blood of the patient. The patient should have a proper rest before leaving if much bleeding occurs during the treatment. Country indication. Patients with acute infectious diseases. Patients with coagulation disorders. Clinical application. Trigeminal neuralgia. Trigeminal neuralgia refers to the recurrent, short-time, intense pain on facial trigeminal nerve distribution area, without nerve dysfunction or abnormalities in pathological examination. Trigeminal neuralgia can be divided into two types, primary and secondary trigeminal neuralgia. Skin needle therapy aims at primary trigeminal neuralgia. Main points. 听宫 small intestine 19 on the affected side. 合谷 large intestine 4 on healthy side. Combined acupoints. Add 鱼腰 extra point HN4 for the pain due to the first remorse. Add 全疗 small intestine 18 for the pain due to the second remorse. Add 下关 stomach 7 and 颊车 stomach 6 for the pain due to the third remorse. Manipulation. After sterilization, tap the points and the affected area with mild stimulation until the skin is red slightly. Once daily, 7 days for a course. Alopecia. Alopecia, also called glossy scalp wind or ghost-shaped head, is characterized by a sudden macular hair loss on the scalp. Points. Usher points. 百会 Governor Vessel 20. 风池 Gallbladder 20. Manipulation. After regular sterilization, tap the skin on usher points and Governor Vessel 20, Gallbladder 20 with mild stimulation until the skin has a little bit of bleeding. Then scrub the skin with ginger. The therapy may be administered once daily, 10 treatments for a course, a week for the interval between the courses. Cervical spondylosis. Cervical spondylosis is due to the pathological changes on neck vertebral or cervical soft tissues, which result in comprehensive symptoms occurred in neck nerve root, spinal cord, vertebral artery, and the cervical sympathetic nerve. It is mainly manifested as pain on head, neck, and shoulders, and dysfunction on the upper limbs. Points. 颈夹脊 风池 Gallbladder 20. 肩颈 gallbladder 21， 肩盂 large intestine 15， 曲池 large intestine 11， 外关 3 energizer 5。 Manipulation. The patient takes a prone position. After regular sterilization, the doctor tightens the cervical skin with left hand and tap on 颈夹脊 gently until the skin becomes slightly bleeding. Then tap the selected points with the same manipulation. Cupping therapy may be applied on flat area. Moxibustion may be used at local area for 15 minutes. Once or twice a week, 10 treatments for a course. Lumbar muscle degeneration. Lumbar muscle degeneration refers to the chronic injuries of lumbar sacral soft tissues, such as muscle, fissure, and ligament. It is mainly manifested as lower back pain. The main pathological changes are located in the waist muscle, fibers, and the deep fissure tissues. Main points. 肾腧 bladder 23. 命门 governor vessel 4. 大肠腧 bladder 25. 腰阳关 governor vessel 3. 腰眼 extra point B7. 夹脊 extra point B2 on the corresponding affected area. Manipulation. The patient takes prone position. Tap the selected points and extra point B2 after regular sterilization with moderate stimulation until the skin becomes flush with a little bit of bleeding. Cupping therapy can be applied on the corresponding points for 15 minutes or until the extravasate and the blood reach 3 to 5 milliliter. Twice a week, 5 treatments for a course. Herpes zoster. Herpes zoster, caused by varicella herpes virus, is characterized by a cluster of blisters distributed like a belt along the nerve of one side of the body, and is accompanied by a burning sensation and a pricking pain. It is also called spider sore. Points. 夹脊 extra point B2 on the corresponding affected area. 阿氏 points. Manipulation. After regular sterilization, tap extra point B2, herpes zosters and the surrounding skin, until the zosters are broken and the skin is congestive. Cupping therapy may be applied at the disease area after skin needle therapy. Once daily and 7 treatments for a course. As a commonly used therapy in acupuncture practice, skin needle therapy is effective, especially for skin diseases and soft tissue injuries. It will be applied more widely in clinical practice and family health care with the development of acupuncture science.